Knowing details about jaundice sign, symptoms, causes, and treatments. Jaundice is a disease which causes yellow discoloration of the skin, mucous membranes, and the whites of the eyes caused for an increased level of bilirubin in the blood. Jaundice is also known as icterus. What is bilirubin and what is the normal level of bilirubin? Bilirubin is formed by the daily natural breakdown of red blood cells in the body, and the liver helps to excrete it in the form of bile. Bilirubin is brown and yellow in color, and it is this pigment that makes feces brown. Levels of bilirubin in blood are normally below 1.0 mg per deciliter, 17 micromoles per liter, and levels over 2 to 3 mg per deciliter, 34 to 51 micromoles per liter, typically results in jaundice. The skin normally becomes yellow once levels reach between 2 and 3 mg per deciliter. Jaundice symptoms are seen when at high bilirubin level. High bilirubin is divided into two types. 1. Conjugated. This means it is water-soluble and can be excreted. 2. Unconjugated. It is water non-soluble, can't be removed from the body. Unconjugated bilirubin is toxic, but conjugated bilirubin is usually not. Conjugated bilirubin can be confirmed by finding bilirubin in the urine. What are the causes of jaundice? Jaundice may be caused for different reasons. We will discuss on this. Prehepatic. Prehepatic jaundice is caused by anything that causes an increased rate of hemolysis, breakdown and destruction of red blood cells. Examples with increased breakdown of red blood cells include malaria, sickle cell crisis, thalassemia, autoimmune disorders, spherocytosis, glucose 6-phosphate dehydrogenase deficiency, G6PD, pyruvate kinase deficiency, drugs or other toxins. Hepatocellular, the problem arises within the liver. Jaundice in these cases is caused by the liver's inability to properly metabolize and excrete bilirubin. Examples include hepatitis, commonly viral or alcohol-related, hepatotoxicity, liver cirrhosis, drugs or other toxins, Gilbert's syndrome, Crigler-Najjar syndrome. Posthepatic jaundice in these cases, also termed obstructive jaundice, is caused by conditions which interrupt the normal drainage of conjugated bilirubin in the form of bile from the liver into the intestines. Example: gallstones in the bile ducts, cancer, pancreatic and gallbladder or bile duct carcinoma, pancreatic pseudocysts, strictures of the bile ducts, pancreatitis, parasites, cholangitis, congenital malformations. Neonatal and newborn jaundice. Neonatal jaundice is usually harmless. This condition is often seen in infants around the second day after birth, lasting until day 8 in normal births, or to around day 14 in premature births. It can also be for other reasons. Examples: ABO or Rh blood type autoantibodies, hereditary spherocytosis, glucose 6-phosphate dehydrogenase deficiency, breast milk jaundice, breastfeeding jaundice, cephalohematoma. What can be the jaundice sign and symptoms? Common signs and symptoms seen in individuals with jaundice symptoms include yellow discoloration of the skin, mucous membranes, and the whites of the eyes, light-colored stools, dark color urine, itching of the skin. The underlying disease process may result in additional signs and symptoms. These may include nausea and vomiting, high or low fever, abdominal pain, weakness, loss of appetite, headache, confusion, swelling of the legs and abdomen. Investigation and diagnosis of jaundice. Investigation and diagnostic test will be needed upon the patient's conditions. Your doctor will perform a physical examination. Know about different options: investigation and diagnostic test. A blood test is usually performed to confirm the diagnosis of jaundice, which includes bilirubin tests, full blood count of red blood cells, white blood cells, and platelets, and hepatitis A, B, and C tests. Blood tests: complete blood count, CBC, liver function tests, including a bilirubin level, lipase/amylase level to detect inflammation of the pancreas. Urinalysis, imaging studies: ultrasound, CT, MRI, etc., liver biopsy. What are the treatment options of jaundice? Treatment depends on the cause of the underlying condition leading to jaundice and any potential complications related to it. Hepatocellular jaundice is treated with antibiotic medications and steroids. Hemolytic jaundice is treated with iron supplements, sometimes intravenous fluids, medications, and blood transfusions may be required. Obstructive jaundice is treated with surgery to remove the obstruction followed by medication. There is also medication-induced jaundice. In such cases, the medicines are discontinued and alternative medicines are prescribed. For infants with jaundice, the treatments include phototherapy, blood transfusion, self-care at home for jaundice. The objectives of home care helps symptom relief and improve the medical condition. The various measures that may be undertaken, which can include: maintain adequate hydration by drinking fluids. Complete rest is needed. Take medications only as instructed and prescribed by a healthcare practitioner. Avoid medications, herbs, or supplements which may cause detrimental side effects. Consult a healthcare practitioner for advice. Avoid drinking alcohol. Certain dietary restrictions: avoid oily food may be recommended by a healthcare practitioner. If any time symptoms worsen or if any new symptoms arise, don't neglect it. Consult a healthcare practitioner. In certain cases of newborn jaundice, the parents or caregivers can place the baby next to a well-lit window a few times a day to decrease elevated bilirubin levels. In more severe cases, a healthcare practitioner may need to discharge the baby home from the hospital with home phototherapy. Provide adequate milk intake for the baby in cases of breastfeeding jaundice.
Visit our website www.medihelp365.com. Find doctors, hospital, medical service provider information. Read article and lots more. Subscribe our YouTube channel Medical Help 365 Days to see medical videos.